Hello, I'm Dr. Deborah Jiang. I'm a radiation oncologist with Cape Cod Healthcare. It's actually quite a lot that we do. So we are part of the interdisciplinary oncology team. So we work very closely with surgical oncologists and medical oncologists. We are the radiation arm of cancer care. So usually we take a patient through their entire cancer care experience regarding radiation. So I see new patients. I see if there's a need for radiation in their cancer care. I tell them about the different options, the different treatments in a consultation visit. That's usually my first visit with a patient when they get referred to our practice. Then, if they sign up for radiation, I will work with our team of dosimetrists and physicists to do a personalized, individualized radiation plan for each patient. We do that, and then once they start the treatment, I follow them during treatment, monitor for side effects, help them with the side effects if any are present during the treatment. And then once we finish, we continue to survey them for cancer, and if there's any indications for treatment in the future, then we get involved in that as well. I've always had a lot of interest in physics, and when I was going through medical school, one of my friends helped me explore the specialty of radiation oncology, which is quite unique in most of the medical specialties in that it combines physics with cancer care. I did a few rotations shadowing some radiation oncologists at my medical school, and I really like the day-to-day interactions that you are able to have as a radiation oncologist and the impact that you can potentially have on your patient's course of care. It's very rewarding and humbling sometimes to be able to guide patients through this experience. I know for most patients, it's the first time they're going through a serious medical difficulty, especially cancer. That's something that can be very, very rough on people. And just being able to be part of that care, being able to tell them about the options, helping them with their decision, guiding them through the treatment, which can sometimes be very, very difficult and prolonged. Sometimes our treatment go up for 8 or maybe even longer weeks of consecutive days of radiation. And then once they get through that, to help them through the recovery phase and then just basically seeing them recover and getting cured. I think that's one of the most rewarding parts. But not just getting cured, because sometimes there are incurable cases, but maybe being able to help them with their symptoms, with their breathing, with their pain, all of that I think is also very rewarding. We work very closely with the other physicians in our department and within the hospital. So first of all, there's tumor board where we meet with the other medical oncologists and sometimes the surgical oncologists and discuss and present all the patient cases. It's a very useful tool, particularly if there's some borderline or harder, more difficult cases where we can kind of go over all the options that are available, and then everybody can weigh in and we can all agree on what might be the best option for each patient. Within our own department itself, we also have a daily chart rounds where each of the physicians goes over briefly the patient that they have and the type of plan and radiation that they're planning on delivering to the patient. If anybody has any suggestions or if there's any changes, that's a valuable time to make those. Not only do we work with other physicians, we work with other allied health professionals as well. So I work very closely with my nurses, the front desk, the ones who take the patient messages and help make us our appointments. We also work with social work, which is very important. A lot of people have some difficulties during their cancer course of treatment, and social work is very invaluable in providing assistance for both us and the patients there. We also work with other people like speech therapy and physical therapy sometimes, so that patients who are having issues, particularly with swallowing with certain types of cancer care treatments that we provide, can get the help that they need. I try to do things that will make tomorrow a better day, but I also try to keep in mind, be mindful basically of doing things that will make sure that today will emphasize what's important to me. And I think it's very important, especially for cancer care patients and everybody in general, to find what's important to them, because my values might not be the same as their values. And it's important to respect that everybody has different things that they care about. I've mentioned this already a little bit briefly, but I think it's important to know that everybody values different things. So that's why I like to present the different options to them, explain the pros and cons of each. And I usually try to leave the final decision, if everything, all else being equal, to the patient, just because I know that what I might recommend might not be what they're seeing as the most important step in their treatment. I have a lot of hobbies. So I really like art, both physical media and digital. So I like to just kind of draw what's around me. Sometimes I have a little sketchbook, and then I also, I know like digital art is all the craze these days. So I have an iPad and kind of like a digital pen that I like to do drawings of. So that's one hobby. I also really like going to the outdoors, so that's very good because I'm on a Cape where that's very possible. I like going to the beaches. I like just walking around among the trees, among the flowers, just some different neighborhoods, and just enjoying the outdoors. I also really like cooking, trying out different recipes from online, trying out different like cultural recipes as well. So there's a lot of things I like to do around the Cape.